Howdy, everybody. I'm Matty Moore. I'm a GP from Dunsborough. I'm a Chief Medical Officer at Mode Healthcare, and I'm really glad to be here today talking to you about PTSD, and specifically my patient Derek Pyra and the incredible use of medicinal cannabis after failure of all the first-line therapies. So just want to make an acknowledgement first for a few people on our team that have taken care of Derek. First off is Lucy. Lucy introduced me to Derek a few years ago and gave me the opportunity to really be passionate with this patient cohort, and really fortunate to now have a great relationship with Lucy. And another is Claire Barker from Ventura, and also let's see, Tom Brown from Honolulu. Tom introduced Derek and I, so I appreciate him as far as his introduction. And also David Hermes, formerly from Beacon, who gives compassionate, or has given compassionate medication to Derek because DVA wouldn't pay for his medicines. And lastly, Matt Henderson, who's an independent lawyer extraordinaire who helped us with our DVA application. So, at any rate, so when we think of PTSD, we think of extreme anxiety, and that doesn't exclusively occur in our veteran patients. There's many millions of people across Australia who have PTSD. Actually, 12% are the statistics of PTSD, and you know, that's pretty significant, and it's always good to be alerted to that, so that we, as doctors and also members of society, can be more sensitive and understand and help manage it better. So PTSD is a condition that is a significant one after a stressor, a significant life event, which brings on many different other comorbidities, including anxiety, depression, anger. And before diagnosis, that affects the quality of life significantly in a negative way. And even after diagnosis, with medications that, first-line therapies that are potentially make things worse and can make things worse. And so, you know, we've been using, as a society, cannabis as a medicine for a long, long time, and specifically in this patient cohort. So I just wanted to delve into that a little bit, talk to you about Derek, give Derek's story, and introduce cannabis as a treatment for PTSD. So what is PTSD? You know, what are the symptoms to look for? You know, PTSD is anxiety on steroids, basically. And we have a significant life event that changes the brain to where we can no longer inhibit the fear response. And so our first-line therapies include benzodiazepine, SSRIs, SNRIs, tricyclic antidepressants, MAOIs, anticonvulsants, antipsychotics. And when you look at a risk and a harm reduction standpoint and compare all those medications with cannabis, for me, it's a no-brainer. And it's really hard to convince our group of professionals, doctors, in order to go down, jump off the cliff, so to speak, and go down that road to treat a really significant mental health diagnosis. So when we do, it can be life-changing. And in the case of my buddy Derek Pyra here, it was. In 2003, he had several significant events, most of which he's unable to talk about. And that set off a cascade of symptoms, including anxiety, depression, hyperirritability, hypervigilance, insomnia, nightmares, breakdowns of relationships, significant anger. And so in 2005-06, he had an official diagnosis of PTSD and started on many medications, which after a while just wasn't cutting it. After 9 years of hospitalizations, Derek sourced his own cannabis as a medicine. And that's when I was introduced to him at that time, and we started him on a full balanced, full spectrum cannabis oil, and he's on cannabis flower as well. So I just wanted to introduce Derek and allow him to tell a little bit of his story. So take it away, my brother.
Thanks, Matty. No worries. Is this the one where we've got the slide with the comparisons of medications and sizes, or?
I thought we did, but I'm not sure where the slides are.
Oh yeah, that's cool. That's cool. Yeah, okay. Yeah, I guess most people have sort of listened or heard what's going on with stuff. My background, my story, as Matty said. Do you want me to go through stuff again, or?
Yeah, sure. Start out with 2003 and.
Oh yeah, cool. Yeah, so we went over to Iraq in the beginning of 2003 in February. We were setting stuff up. I was Air Force at the time doing comms, and we were setting up in a country for the F-18s to go in and do their operations at the time. So I don't really go into stuff because it's sort of, half of it I can't talk about, another half really screws me up in the head. So and I guess it's an interesting thing with veterans about PTSD and talking about their traumas. I guess most people in society associate veterans' PTSD and their trauma being a frontline troop, for example. Frosty here, prime example. Me being Air Force, normally when we deploy, we go to 5-star hotels. So, there's a difference in comparison of traumas, I guess that way, but yeah. So anyway, yeah, what happens is all the same and the treatment's the same, yeah. So I guess sometimes it's confronting, obviously, talking about your bits and pieces. So 2003, at the end of 2003, back in Australia, just stuff wasn't going properly. I wasn't operating properly. I wasn't thinking right. I got back from my deployments overseas, and everyone noticed I was different. I was changed. But I think about a year after that, or 6 months after that, I just sort of sought help on base, getting some psychiatry help, or psychology help, sorry, at the time. Got out of the military a bit after that. A year later, 2006, got diagnosed in 2006 PTSD, officially, I guess. And then medication started that year. The first year it was interesting. You start on one medication and within a year you're on 2 or 3. This is the mental health I'm talking about, I guess. And then the medications sort of don't work. They change you to different ones. Medication dosages increase. Medications become ineffective over time. So the dosages increase to dangerous levels. And it's not a way to fix a veteran with PTSD to sort of do it that way. It doesn't work. It's ineffective. And I guess, a lot of things happened. There was, as Matty said, in and out of psych hospitals for 9 years. On average, at 100 days a year on average, I think it was. And there's a cost involved as well with treating veterans, and it's the taxpayer that pays for it. So that's $100,000 a year just in hospitalisation, and that's from pharmaceutical medications from not working. So 2015 in May, was the last time I was in hospital, and that's when my life changed. Yeah. So it was a bit difficult, which is probably why I'm tearing up a little bit, but I've got it. It's all cool. I needed something different to happen in my life, and I saw this documentary on SBS. It was a series called Weed Etiquette, and it was called Stone Veterans, and it compared two veterans from in America that were both from the same campaign in Iraq as I was. And one was stuck being on the pharmaceutical medications from Veterans Affairs over there, and the other was using cannabis illegally. And the quality of life was totally amazing. The dude on pharmaceuticals was where I was, and the guy on the cannabis was leading a happy life. He had a family, he was functioning, still had his symptoms, but you know, kids were like, "Hey, Dad's not cranky," you know, it's all good. So I tried it, and I did experiment in my 20s, even though I was in the Air Force at the time. I joined when I was 15. It's a bit young, but it was good. In my 20s, I did use a little bit of cannabis a couple of times here and there, I guess, recreationally. But when I tried it in 2016 for this PTSD stuff, because I was like, fuck, I've got to try something different, I had like crippling anxiety that just made me like feel like I was going to vomit 24/7. I had that all the time for like months, and you know, you get used to it. But that and the depression, it just went away really quickly, like instantly. And I was like, okay, this stuff's working. Cool, all right. So I kept using it, and I told my treating psychologist about it. They were like, holy cow, you're actually doing better. Don't stop, keep this going. And then, yeah, it's sort of like, I was able to get off my heavy doses of prescription medications with that. And I mean, you're talking psychotropics like Seroquel. Dosages, I think, Sue Sisley, you'd say a dosage for a psychotropic would be maximum, what, 400 odd milligrams a day? Something like that is recommended. Or, yeah, I was on at one stage about 1800, including PRN milligrams, and all the other medications are really high like that as well. Like, the photo of me, comparison's really funny. I'm like about 120 kilo, big long beard, big frizzy hair. You wouldn't even know it's the same person, but that's the difference that medicinal cannabis or cannabis used medicinally can do, I guess. Yeah.
Rusty, tell me about you, buddy. Tell me about your story.
Yeah, thanks, man. So a bit different to Derek, but again, it's the same story that repeats. I'd served 16 years in the military. I had a pretty physical career, so by the end of 16 years doing a job that was pretty full on in the army, a lot of it was with assault boats. I was about 4 centimeters shorter from spinal compression, and I'd had a number of traumatic head traumas and everything else, which was just part of the normal job that you go through. So when you're kind of dealing with that over years, you don't really take note of what it's doing to you, because it's kind of, you've always got a medic there on standby. There's always an ambo following you around, whatever you do. The guy next to you is usually qualified in first aid too, so you get pretty much good encouragement to push yourself against that wall and smash into it as hard as you can repeatedly. And it's encouraged to do that over again, but do it proficiently. So after 16 years in that type of job, and a lot of the guys from my era have got a lot of crazy issues, and again, PTSD is part of it. I didn't just have PTSD in my head, I had PTSD in my body. My peripheral nervous system was shot from heavy impacts. That memory's kept in there. So when we get out, we get medicated. There's prescribing algorithms our doctors use now, and they go down this matrix, and we've got guys on over 20 medications now. So when I discharged in 2015, after 2 years in about 2017, I weighed 117 kilos. My wife was my full-time carer. I was having seizures. I couldn't barely even, I was dribbling on myself. I'd had head traumas and side impact traumas that were causing my neural network to retreat. And this wasn't discovered until later, once we started actually doing QEEG scans on the brain to see what it is. So PTSD is not just a mental health disorder, it's a physical condition that people are suffering from.
Your brain changes.
Yeah, absolutely. So for me, I did a similar thing to Derek. I snuck out to some servo one night when I'd heard about medicinal cannabis, asked the dodgiest dude I could find to get me some weed, and then I jumped in my car, drove to some dodgy little suburb. And then he went inside with money, came back out with a little bag of weed. I went home, snuck downstairs, hid away from my wife, smoked it in a billy like I would as a kid, and then paranoid, I stepped back upstairs and crept into bed, and I slept for 6 hours for the first time in probably 6 years. And that, when, again, I woke up in the morning, and again, you can achieve those type of sleeps by drinking as much alcohol as you can or taking as many pills as you can, but you don't wake up feeling refreshed. I woke up in the morning, I was able to get out, go outside, start interacting with my family again. Took 2 years of physiotherapy for me to start building up the muscles around my spine again to build that back up. And again, PTSD, it's a sidebar. There's all these other issues in there. The brain, when it retreats, it doesn't like playing the game. So cannabis helped me do that. But again, it was a platform. I used other things like nutrition and exercise and mindfulness and all these other things that I was able to do, which didn't make sense when I go and see a psychiatrist or a psychologist and they go, dude, just don't think about it. Think about this instead. It's like, I don't know, mate, I give it up instantly. It just doesn't work. Using the cannabis as that platform, it works. There's no other way around it. You get that platform if you get that right balance, and it does work. And again, that drove me to where I am now. I used certain things to help me get better and had to break rules. There's some beautiful people at the back there, part of the original Weirded Warrior crowd that back in the day helped us get access to this. And really, we as veterans are in an incredible position here. The Department of Veteran Affairs is authorising since 2017 chronic pain for PTSD. We've now got hundreds of veterans access to this around Australia, and now we've got the data of what's happening to them, and we're starting to release some of the initial clinical findings. People are reducing their benzos, they're reducing their opiates, they're reducing Lyrica, they're reducing antidepressants. Do we need more evidence when we start seeing some of these guys start to throw out their other medications? Like, we are now lobbying the Department of Veteran Affairs and the federal government to change one simple rule in DVA. They've already authorised this for veterans with PTSD. Originally, when it came out, we had veterans receiving this for PTSD. Now we've got guys on incredible amounts of psych meds with brain injuries that are making them 10 times worse, and they won't give us a simple Anyway, I won't go down the rabbit hole with that stuff.
Preach it, brother, preach it.
Preach it for a sec. We've proven it's cost saving, we've proven it's efficient, we've proven it works. We've given DVA more than 20 odd scientific peer-reviewed pretty much studies from around the world showing it, all recent stuff, but in the same answer every single time. Insufficient clinical evidence shown.
So frustrating.
That, it's going to work for PTSD.
I will say one more thing too, and I'm part of an organisation at the moment. I'm president of the Woggers Defence Shed, so we've got a bunch of emergency services and veterans that come in and do skills and equipment. We've now, because we've built this up and we've got a membership base there, we've managed to get a monastery now to set up for all these services to bring them into one spot. We've got clinical services now where we're linking into the universities. We've got scanning tools now that you can take imagery of the brain and show neuroinflammation. CSEP scanning, this exists. We're creating the particles to this in Australia now. This is not out of reach from the States anymore. So again, come and speak to us. If you've got clinicians that want to research this stuff and do it properly, we've got the data now. And again, if the more public understand and can see the images, double-blind placebo, do it to your heart's consent. We can show images like a broken arm now of the brain before and after these treatments. There's not much else we need to show, I don't think.
So Sue, do you have data from the Department of Veteran Affairs in the States? I mean,
I wish we did. I mean, unfortunately, the data that the VAs generate is all safety studies looking only at harmful effects of cannabis and addiction potential. Mm-hmm. So unfortunately, we don't have any positive VA data looking at this as a medicine, but I anticipate this is going to change. We just had a big breakthrough. I mentioned this in my lecture earlier, that we, for the first time ever, got our federal VA system to approve a few hospitals to participate in a clinical trial with us. So we designed the study looking at inhaled cannabis flower for treating uncontrolled pain in military veterans, and we have a VA hospital in Florida and one in Michigan that are serving as clinical trial sites for us. So this will be the first time ever that they've even agreed to look at cannabis as a medicine and to look at whole cannabis. You know, they've done a couple studies looking at, synthetic THC that's already on the market here, Marinol. So I think this is going to be really helpful because once those two VAs start executing, recruiting patients, then other VAs will realize that it is okay for them to do this, that they're not going to get, jeopardize their status with the federal government. And I think that'll be a big game changer. I mean, one of the things that these guys are saying that we hear all the time is the veterans tell us, we don't need your studies, Sue. We already know this works. And, thanks for offering to do this, but, we don't need this data to prove what we already know. And the families will say the same thing a lot because they've seen the improvement. But, and I get that. I mean, it is very tough to generate positive studies with cannabis, because the problem is that conditions like pain and any psychiatric illness, PTSD, anxiety, all these, they have such high placebo response rates that it's very difficult to beat placebo sufficiently to be considered a medicine. And so if that's the case, then you start wondering, should we even be doing this? Because that's why we stopped and started doing work with psilocybin mushrooms, because I realized that if I was continuing to generate negative studies, that was actually harmful to the vets. And I saw that happening where our negative data was then being cited by the VA hospitals to justify why they wouldn't allow access. So it's like a no-win situation. We're, like I said earlier, we are now embarking on a study using real-world flower and hoping we get a different outcome. But you just got to know, in general, these placebo-controlled trials are designed to favor the big pharma medications, because that's one molecule targeting one receptor in the body. It's much easier to prove benefit over placebo with that. With cannabis, it's a complex plant. There's hundreds of different molecules. So that's where we start to have trouble, because there's a strong desire from people who are in a study like that, who already have a psychiatric overlay, that they want so bad for the study drug to work that they report positive responses to placebo. And just the benefit of being in a trial and having the social support of being seen by our research team every week is, seems to be beneficial to people. So I bring this up only because I say eventually at some point we have to just fight for what we know is helping the vets instead of waiting for trials to get done. I mean, we've been at this now for almost 15 years, and we realize that the path to getting FDA approval is still miles away. And we have veterans, dying every day here. We have, a massive, not the disability itself is brutal. And then the loss of life. We have a serious suicide epidemic all over the globe, and especially in the US, it's just relentless. So I think we have to start saying at some point, how is it that Israel and Canada always felt that their veterans deserve not just legal access, but deserve that the taxpayers would fully sponsor the cost of their marijuana each month, and yet other countries don't feel there's enough data? Canada and Israel have over 10 years of data now, observational data, confirming that that veterans are benefiting from this. And like you guys said earlier, that this is a very inexpensive medicine compared to all the standard prescriptions they give out. So there's just no explanation for this anymore. And at some point we just have to, we have to make demands in court, like I was saying earlier, using the court system to force the government to do the right thing may be our best bet.
Hey Sue, it's Derek here. I don't know if you can see us, but I'm in the middle. We've got a Royal Commission that's starting up, well, that's going at the moment into defence and veteran suicide. You probably know about that one. But I guess we're hoping the findings from that should show that in regards to medicinal cannabis for PTSD, that it works. It's going to be delayed though. I think the Royal Commission got extended.
Yeah, so they've had that many submissions right now that the Royal Commission's had to extend another 12 months, but it's going to be rolling. So we've got initial submissions in with all the medicinal cannabis. And again, if anyone's got research on this, come and hit us up. We're providing now, this is public information to the Royal Commission to show what's working and what isn't. All of these submissions have to be looked at. So if anyone wants to get involved with that, please help us. We can then use that as our data. So to show what's working and what isn't. Once DVA's got that, this is veteran suicide. This is what we're dealing with every single day. Cannabis is part of that. All of this is part of that. Guys now are taking medication that have suicidal ideation as a side effect, and they're told not to get off it because they might get suicidal, and they've got a brain injury that makes them suicidal. It's crazy. It's like, we know what will help it, so let's kind of focus toward that. But the Royal Commission's not going to be useful unless we make submissions to it. We can't just expect them to investigate and find out the answers. We need to, as medical professionals, as veterans, as the community that have family members that have dealt with this too, if you have dealt with suicide and it has been related to defence, it's not DVA's fault, it's not anyone's fault. It's our whole organisations and communities that can get behind this and make this a little bit different. I think it's culturally, it's not just veterans and first responders. Culturally, suicide is crazy at the moment. People are on antidepressants more than any other medication. Literally, it's the highest prescribed drug in Australia is an antidepressant. Most 1 in 5 Australian adults before COVID are taking antidepressants now. Kids are taking them as young as 5. This is insane. Sorry.
So Sue, it's really interesting.
He's very passionate.
Yeah, it's really interesting, Sue, to hear about the states and as forward-thinking they are on cannabis, and we're seen as behind, but therefore but again the research, to prove its safety and efficacy is certainly in this population isn't that much further than we are here in Australia. Really interesting.
Yeah, that it is astonishing that it just shows you the how shrewd our government was when they erected these hurdles to conducting this research. They were very strategic in making sure to impede the research from, so it was so hard to get the studies done. Most scientists wouldn't even embark on this work. We're still experiencing this very slow momentum now where, there's become like a renaissance of psychedelic research, but cannabis is still stuck in phase 1, phase 2 trials. And that's why I say it's not worth waiting. The idea that we're going to provide the Royal Commission piles of randomized controlled trials is not realistic. They don't exist. Our study was the first and only randomized controlled trial in the world looking at cannabis for PTSD, and it was a negative study. So I won't be submitting that to the Royal Commission because I don't want them to twist that and to fulfill some other agenda. But I think they have to understand that the research on this has been, systematically impeded, and they need to find other ways to collect data. They're welcome to, I would invite the Royal Commission, if they want to do something meaningful, to fund a study with your guys' cannabis over there. I can provide you the scientific protocol that we're using here that's been approved by our FDA, so they don't have to start from scratch. They can just take our study protocol, and we can create a clinical trial site and let Royal Commission. I'm sure they have plenty of your taxpayer money to pay for something like that, and that would be a worthwhile. But again, I almost hate to propose that because ultimately we really don't need more studies. There's plenty of data that may not rise to the level of the gold standard randomized controlled trial, but as I showed you earlier, 2 major observational studies published in mainstream medical journals showing immense benefit, minimal side effect profile.
True.
I feel like, the evidence, there's plenty of evidence, even if it doesn't meet the rigors of the snooty academic community,
Or the double-blind gold placebo standard, whatever it is. Yeah. Good luck hunting that one down. Yeah.
Well, I was going to open it up to questions if you guys wanted to do so, and I'll run the microphone around.
Hi Sue, back again. I was just wondering, it's off topic to cannabis, but can you tell us anything about MDMA for veterans, MDMA therapy, and if you were able to discuss that with the Royal Commission?
We would love to do that. That is something where we finally have really positive randomized control trials to support. I mean, the FDA has told us we're 1 year away from getting MDMA assisted therapy approved for PTSD in general, across PTSD of all causes. So that's exciting, except, again, this is the typical model that pharma and FDA like, one molecule targeting one receptor in the brain. So it still doesn't really open the door for other plant medicine, but it does set hopefully some standards for psychedelics in general. So you'll see that we just unblinded the data from our second phase 3 trial. So we'd be happy. The data from the first phase 3 trial was so astonishingly solid. I don't know if many of you guys might have read about this, where 2/3 of the patients in the MDMA trial had no detectable PTSD at the end of just the 3 MDMA sessions and about 3 months of psychotherapy. So that's incredibly effective. That it's not just improving the PTSD, but curing it, putting those people into remission. And another 20% of the patients had significant improvement, but not fully cured. So yeah, we can definitely submit the first phase